Hello everyone, welcome back to my channel Medical Research with Mohan. Today I'll to demystify some of the confusion regarding variables and data. My promise to you as always is I will try to help you understand the concept rather than memorizing the definition. Next, I will describe the different types of variables and data, and third will be importance of classifying data. So this is continuation of my previous slide, which divides the variables as categorical, numerical, and time to event. Categorical data are also called qualitative data because they describe the characteristics of the variable under them. And numerical data is also called quantitative data because they define the amount under this numerical variable. Time to event data is a hybrid of time, which is a numerical data, and binary data, which is an event of interest. So categorical data is also is further subdivided into the nominal and ordinal data types. Nominal data type is a type of data that can be labeled or classified into mutually exclusive categories within a variable. That's why they are called island data. And there is no inherent order to the categories. For example, in this A, B, C, D, they stand in isolation. Few examples here. What is your country of birth? You can be born in more than 200 countries. And why it is said mutually exclusive is this: you cannot be born in both in Nepal or in India. You can be born in only one place at one time. Second is, what is your occupation? You are a doctor, engineer, pilot, or administrator. You can be one. And what is your marital status, like single, married, divorced, or widowed? You cannot be both at one time. So these are some examples of nominal data. Uh, Under the nominal data, there is another type of data called binary or dichotomous data. It's a type of nominal data. It takes on only two values, either yes or no. Few examples are you wearing mask? Yes or no. Have you quit alcohol? Yes or no. Or other example, does the person have cancer? Yes or no. The patient has wound infection? Yes or no. What is your biological sex, male or female? Or you can ask the question as, is the subject male? Or, if you are a doctor or nurse on duty during the COVID-19 pandemic, are you in COVID or non-COVID duty? These are the examples of binary data. Let's talk about ordinal data. In ordinal data, there is an inherent order to categories, but the degree of difference between categories is not clear. Say in this example, A is bigger than B, B is bigger than C, C is bigger than D, but we do not know how big is B compared to C or how big is A compared to B. In those type of situation, we use ordinal data. And in ordinal data, numbers are not really numbers. This is an example of the visual analog scale for pain, and you can have no pain to worst possible pain, and it is expressed as 0 to 10. So these numbers don't really represent number. These are actually values that express the degree of pain. So, and this is there is inherent category. There is a difference between 0 to 1, 1 to 2, 2 to 3, 3 to 4, but we do not know the magnitude of difference between this and this. So 1 is definitely bigger than 0 and 2 is definitely bigger than 1, but we do not know. There is no fixed difference between 0 to 1 and 1 to 2. Another example would be size of this t-shirts, and this shows a small, medium, and large. Large is bigger than medium, and medium is small. Medium is larger than small, but we do not know what is the exact size difference among these three types. Let's talk about the numerical data. Numerical data refers to actual numbers, and one unit change in the value means the same thing across the entire range of data values. This is in contrast to the ordinal data types, and there is a fixed and meaningful difference between them. The examples would be temperature, weight, weight of the individual, or this is a monitor in the ICU monitoring the different vitals of a patient. So these are all examples of numerical variable. Numerical variables are further classified as interval or ratio types of numerical data. In interval, there is no true zero. The example would be the temperature. Temperature, you can have minus 10 degree centigrade temperature. So zero is not absolute zero in the interval type of data. Whereas in ratio type of zero, zero is absolute zero. You cannot have minus 1 kg weight. The lowest you can go is zero. Same thing with pulse. So one person cannot have minus 10 pulse rate. So this is the difference between interval and ratio type of numerical data. However, in clinical research, these type of data are often handled together, and we do not need to go into the details of the difference between interval and ratio type of data. Similarly, the numerical data is also divided as discrete or continuous data type, another way of classifying. So in discrete type of numerical data, data cannot be less than a certain value. The examples are the number of family members, students in the class, pulse or blood pressure. And you cannot have 5.5 family members, or a class cannot have 28.5 students. Similarly, your pulse rate cannot be 72.5. So below certain, it cannot be in fractional point. Whereas in continuous type of numerical variable, it can take any number. The example would be weight or height. Somebody can measure 160.2 centimeters. So you can take the, fractional or decimal value. Good news is again this: in clinical research, most of the numerical data are handled together, and we do not really need to differentiate between discrete and continuous for the health science research purpose. Sometimes numerical or ordinal variable is converted to binary for analysis purpose, especially when your sample size is less. Then this is usually done. For example, age is a continuous type of numerical variable, but you can dichotomize them as above or below 40 years for the analysis purpose. Similar, this is the table showing the Glasgow outcome scale. It shows the score as 1 to 5. This is a type of ordinal data. So, when you do the outcome analysis, you can lump them 1, 2, 3 as having favorable outcome, and 4 and 5 as having unfavorable outcome. So, sometimes this is continuous or ordinal data are converted into binary data for the analysis purpose. Let's talk about the time to event data. Time to event data are longitudinal data in which subjects are followed from a clearly defined starting point until they experience the event of interest. So time will be there and the event of interest will be there. It's clearly two components. So that's why they are called hybrid type of data. Let's take an example of this one person who is very motivated to quit alcohol, and the person joins a alcohol cessation therapy, and the time the person takes to quit the alcohol finally will be expressed as the time to event type of data. Another is time to relapse after the remission of the tumor is there, and this is an example of a Kaplan-Meier curve, which shows once the person is diagnosed with certain type of disease, how long the person takes to die. The number of persons, I would say. So this is expressed as a time to event, time death since the time of diagnosis. These are all examples of time to event data. And in oncological research, time to event data are used most frequently. Now we have classified different data types with examples, and sometimes it is confusing, but it is extremely important to classify data. One reason is data visualization techniques are different for different data types. Let's take this example of a paper I published last year. This is a bar graph showing the frequency of clinical features of recent aneurysmal subarachnoid hemorrhage in 199 patients. So the different type of symptoms, so headache, unresponsiveness, seizure, vomiting, focal deficit, and cranial nerve palsy. This is an example of nominal type of data. So this is expressed as in bar graph. Let's take another example of this graph showing the change in blood pressure in a 73-year-old lady over 24 hours. And this cannot be expressed in bar graph. This is expressed in line graph. So depending upon your data type, different visualization techniques have to be used. Another reason why we should classify data is this. So there are different ways of summarizing the data, and we use different statistical tests based on different data types. Let's take this table. It shows different data types and what are the different, summarizing how you summarize the data and what are the common statistical tests you use for different data type. If it is your nominal data, you cannot use mean to summarize your data. You use proportion and you use chi-square test, not t-test. Whereas if you have a ordinal data, you use proportion, not mean to summarize your data. You cannot use t-test, you use chi-square test. Whereas if you have a numerical data, then you use, of course, mean to summarize. You cannot use proportion, and t-test is used to test the association between two population, and you cannot use chi-square test. So it is extremely important to know what your data types are, and then you will know how to handle them. So just to recap today's video, this is a small, this is a data set showing the different variables in four people. So and the outcome is expressed as Glasgow outcome scale. So let's do the practice. So age in years is a numerical data. How about sex? Sex is a binary data. If you use gender can be nominal because you can be other types as gender. But if it is a biological sex, only two options are there, so it's a binary. Heart rate is numerical data. Presenting symptoms, again nominal data, and outcome as expressed in this scale is an ordinal data. To summarize today's video, variables and data are the core building blocks in research. Classification is crucial for visualization and analysis, as different techniques and statistical tests are used for different data types. I hope the information presented in this video is of help to you. Hope to see you next time. Bye.